Well, Professor Agnès, we can begin then. Thank you very much for joining us today. I'm really excited about interviewing you, and I'm really, really enamored with the work that you do. So I'd like to first of all start by asking you a bit about what you feel compassionate leadership is. It's something that you know, has mentioned that, you know, your career has been characterized by, and you've talked about it a little bit before. What key qualities do you feel define compassionate leadership, and who or what inspired this approach for you?
So, first of all my models are compassionate leaders who focus on improving the life of everybody. And from them, I learned that to improve the life of everybody, you need to understand that the more vulnerable you are, the less you are equipped to contribute to improve your own life. So passionate leaders start to identify who the most vulnerable are. And by understanding that, they will come and proactively go to the vulnerable, because vulnerable will not necessarily seek their rights. For this, to be a compassionate leader, you need to understand the context in which people live, especially those you want to serve, and recognize that they are the vulnerable. And by context, I mean the community, the local, the national, and also the global context, because each of these levels impact heavily the life of all humans, the well-off and the vulnerable. But the well-off know how to navigate. The vulnerable doesn't know. So when you are a compassionate leader, you need also to understand that vulnerability has many facets. There are vulnerability linked to poverty, the most common, everybody is informed of, to opinion in some countries or some place, to gender in many places, to age, or to other characteristics of a person. And those different vulnerabilities differ according to the context. This is why a compassionate leader needs to continuously be curious and educate themselves on who the players and the vulnerable in the community are and where they live. That is the district, the province, the nation, or the world. Doing so, they became aware of the strengths and the weaknesses of the systems that regulate their life and the life of their community members, their nation, their region, and the world, because all these levels also are important for each of us, again, for the well-off or the vulnerable. So on top of proactively looking for the vulnerable, a compassionate leader needs to understand the context in which they live and the impact the system have on the life of all, with a focus on vulnerable. And compassionate leaders also need to be humble, attentive, and discreet listeners to the needs of the people in order to better learn how to support and improve the life of vulnerable. This means being a continuous learner about context, players, opportunities, the best evidence-based strategies and solutions. And to make it happen, compassionate leaders also need to promote participation of all, to follow the signs of the day, and to be educator, because to push vulnerable to participate in changing positively their life, you need to pass through community education. This approach is valid to help inclusion of the vulnerable in all sectors, such as health, education, economy. And I learned that when you create access for the vulnerable, all the nation benefit. But when you simply look at increased access of the larger number in the population, Unfortunately, the vulnerable are most of the time left out of benefit. And currently, I'm the Vice Chancellor of the University of Global Health Equity. And that's what we teach. The university that I co-founded is designed to train the next generation of health professionals to serve the most vulnerable communities and build equitable health system. And the education is embedded in compassionate approach. And with a focus on the vulnerable, we are educating the next generation to be future global health leaders. Thank you.
Fantastic. Really, really great answer there. How did your role as a pediatrician prepare you to work in government?
So I want to say first that all started, as far as I remember, because I wanted to be a healer. And this was when I was a very, very little kid, and probably because my father was a doctor. Later in my life, I wanted to focus on one of the most fragile periods of life, our childhood, a period when we fully depend on others, a period when we are voiceless. So when I started to work in Rwanda a long time ago now, it was in 1996, coming from France, I was enthusiastic and immediately worked hard. Unfortunately, without being prepared to this transition into working from France, where children were rarely dying. And when they did, they died from non-treatable diseases or very few accidents. I came to in Rwanda, where I saw more deaths in 5 days that were all, majority of them that were treatable from treatable diseases and unnecessary. I saw more deaths in 5 days than in 5 years working in France. So for the first time, I brutally faced the cruel reality that life and death of children depend on the context beyond the quality of the pediatrician, who, despite all the skills and knowledge the pediatrician has proudly accumulated over time, all this knowledge and skills are useless when you don't have a system to back your skills and knowledge. So immediately I was enraged by the injustice faced by Rwandan children because the majority were dying from curable clinical condition. I understood that the best clinical skills and knowledge mean nothing when there is no system supporting support to health service delivery to implement what we know and save lives. So I started to fight and to learn the hard way my new local and national context, where we lacked system, when we lacked staff, material, when we lacked staff, people to give care. You save a child during the day, you go at night, exhausted, you come in the morning, the child died because there was nobody during the night to take over. When we lack space, there is not enough infrastructure and hospital to treat all the children that were in need. And also, I start to learn the global context, as at that time, we lacked support. In the late 90s, Rwanda has very, very little support. I was helped by my love of research. I have always done research, and still I'm doing research. As a professional, it always helped me to understand those contexts, the community, the local, the general, the global context. It has helped me to understand the needs and how to work better for better outcomes and how to do more with the available resource, being human, financial, or infrastructural resource, or any other type of resource. So because I always conduct research, when I came back in Rwanda, I continue to do research. I always do that, whatever work I'm doing. For example, as a pediatrician, when I came back to Rwanda from Europe, my research was focusing on HIV/AIDS, on children's health, and on human rights. These three subjects were my focus because protecting children's rights is my life passion. Additionally, in Rwanda, the health system was destroyed due to the 1994 genocide against the Tutsi. And the HIV pandemic in Africa was a nightmare. So health system, HIV, and right of children were my focus. HIV also because the continent where I was living was the most affected by that disease. And this approach and way of thinking helped me in my future duty and helped me up to now. Because after being a pediatrician where I learned through research how to work better with what I had, I joined the National AIDS Control Commission as my first public service leadership position. I knew nothing. I had to start from zero. I knew how to treat patients with HIV, children and adults, but not how to manage HIV program and the sector. But again, I applied the same principle of listening, of learning from those who knew, and the majority of them were in the community. I focus on the most vulnerable with no mercy for not doing the most with each resource we had and each opportunity we had, understanding that each success was saving lives and each mismanagement was causing death. So help with research. I add to my research area health program management and policy to help me in what I was doing, managing HIV programs. So I use this approach and I use it to save life of sick children, like before I save life of sick children, now I was using that to save children affected by HIV, women and men, and to protect those who were HIV negative to remain negative. So later on, when I became permanent secretary and minister, I did the same for all age and started research on health sector management, continued research on HIV, and start research on other infectious disease beyond HIV and other non-communicable disease. I expanded my research to health system strengthening and capacity building, technical innovation to support universal health coverage, medical education and implementation science in low resource setting to ultimately create a system with deep long-term change for sustainability. So all along my life, I learn, listen, study and research to adapt to my new work. And everything I did previously helped me in the new position. Such as I worked to pioneer research in the field of implementation science because I had to assure good implementation as for HIV first and for all health later. And this love of science and research was very important for me all along my professional life, and it helped me, my adaptation to the Rwandan context coming from France. This adaptation obliged me to develop flexibility, to adapt to new contexts, keeping the quality in mind. For example, increasing my capacity for diagnostic without all the lab platform I had in France has increased my capacity, my clinical skills, and increase my knowledge as well as my strategic thinking capability. And I brought that with me in other positions. And over time, as I shift careers from clinician to working in management of the health system more broadly, and as a policy maker, I realized that this addition to my skills and knowledge were a very powerful tool for adaptation to new function, new interaction, new opportunity, and also capacity to change the world. On the other hand, research helped me to better understand what I have to do and how I have to do it for better outcome from my work. So you can see that this is how the work I did prepare me always to the next step.
Yeah.
And my lesson to share for this is we need to cultivate our strategic thinking, our curiosity, our flexibility, adaptation, and continuous education to produce better outcome and fit better in the work we do, whatever work you do.
Yeah, thank you. I want to move on a little bit now to our post-COVID world. There's been a lot of debate, particularly at this conference, the FutureSummit, about the way that richer nations are behaving when it comes to COVID vaccinations. What would you like to see big pharmaceuticals and governments do to make them more globally accessible to those who need them most in the low and middle income countries?
That's right. There is a lot of discussion about inequalities in access to vaccine. Look, there is a vast difference in the COVID-19 vaccination rate between Europe, which is fully vaccinated at more than 50%, and Africa, which is only vaccinated 3% of its population. The difference of 47 points is enormous, and that can be explained by nothing except nationalism, selfishness, and lack of respect of science and the life of people who don't look like you. Wealthy nations are storing surplus doses. That's why I'm giving those words: selfishness, nationalism, and don't care about life of people who are not like you, because it's not a lack of vaccine. It's because wealthy nations are storing surplus doses, with some that are going to expire now, soon, if not used. For instance, the United States was estimated to have 500 million of surplus doses, and in countries like Switzerland and Canada, they have ordered enough doses to vaccinate their entire population, at least times 5 over. Wealthy nations have to first, you ask my wish, I want them to urgently contribute to distribute their surplus to COVAX with these doses that are now overstocked. This would support vaccination campaign in low and mid-income countries that are ready. And in parallel, they could contribute with all of us to help prepare countries that are not yet ready. But all those supply vaccine will save already so many lives. Countries should avoid providing unnecessary booster also to those who doesn't need them. This take away from the vaccine supply of countries that have not vaccinated even more than 3% of their population. Moreover, this will not solve the pandemic if they give booster to their already vaccinated people, because 3 shots or 4 shots will not be more protective the day the vaccine will face, the people vaccinated will face a variant that will not respond to any vaccine. So unnecessary booster shot will create favorable conditions for the emergence of variants, rolling back the world and promoting the pandemic within a pandemic, a new pandemic with variant. Because in place to block the pandemic by vaccinating the maximum of people, they give an unnecessary booster to those who are already vaccinated.
Yeah.
So this should not stop discussing vaccine hesitancy in the developed world, but not in Africa, because we know that 80% of the population is willing to get vaccinated, but only 3% have got access to vaccine. So we have 77% willing to be vaccinated without an access. And pharmaceutical firm also, what I would ask, if I could, what I will ask is to stop the unfair price, high price, because they have made enough profit, billions, at the expense of killing people. For example, the recent price of COVID-19 vaccine by Pfizer and Moderna increased by 25% for Pfizer, 13% for Moderna. You can see that in the new contract they have signed with the European Union. While this increased price currently is for developed countries, soon it will come to us when we have already difficulties collecting funds needed to purchase vaccine. And when this will just increase their profit, and they have already got profit we can measure in billion, it's an unnecessary increase in price because the profit of this farm already are huge, as demonstrated by Oxfam in its press release. When you see that the cost of the vaccine, they sell the cost 5 times the price to make it. Even 3 times is a lot, but they go to 5, even in Africa, where we don't have enough money, even in other places in the world. And furthermore, we could solve the problem of lack of vaccine if Africa was supported to manufacture vaccine for its people. Just like Africa produced Coca-Cola all over the continent under a legal licensing framework. Coca-Cola is paid every time an African drink a bottle, making the owner of Coca-Cola richer every time an African drink a bottle. So using the same approach, European and American pharmaceutical firm can make money every time an African receives a COVID vaccine shot manufactured in Africa under license. This will make our population healthier and make the European farm richer. Wealthy nations like the United Kingdom have opposed that. They should allow licensing by supporting COVID-19 TRIPS waiver to expand vaccine manufacturing. A related business also from pharmaceutical firms are not patented, but they don't want to share knowledge. They refuse it to disclose so that other places in the world cannot create vaccine. This will certainly expand. If they do so, this will expand vaccine manufacturing capacity and increase vaccination access, thus creating a stronger herd immunity for the world and keep the pandemic under control. Not that pharmaceutical company will not make profit by doing so. So profit is guaranteed, science is behind the idea, there is a possibility, stock should be distributed. We could together stop the pandemic if rich countries and pharmaceutical firms want it. And they should, because it will bounce back and kill their people as they will kill us.
Yeah, extremely good points made there. I want to finish up, Agnès, by asking you, what have been the biggest challenges you faced as a woman leader, and which other women have inspired you throughout your career?
The biggest problem I have faced is white supremacy because of gender and skin color, the two, gender bias and skin color bias. When a leader is a woman with a black skin, very few expect her to perform well. And this is on a scale of social construct. The expected best performer are white men, second by white women, third by black men, last by black women. So the challenge when you are not known is to make your voice and your idea considered in the global arena when you are a Black woman. This even if the Black woman is more educated, more senior, this prevail. I had to fight these stereotypes and expectations throughout my career to make sure that I could bring the best services to my people. And who inspired me? I was inspired by Rwandan women who have challenged the expected course of history by promoting peace and reconciliation after the genocide, after surviving rape, after surviving the genocide. When I went back to Rwanda in 96, 2 years after the 1994 genocide against the Tutsi, which cost 1 million of life of Rwandan, the health sector was not functional. At the hospital, the children I was caring for were dying from treatable condition because we did not have equipment or medicine to save them. It was very hard, and I was tempted to pack back my bag and run away. But I debated with myself and stayed. And one of the group who pushed me to consider my belief in social justice. At the time, we were only 5 pediatricians for a total of millions of Rwandan children, were the women of Rwanda. So I thought myself, if people with professional skills and healthy like me run away, who will care about the children in need? And thankfully, I stayed. Among those who motivate me were the inspiring women of Rwanda who survived Rwandan genocide. They were in pain and suffering. Some of them raised children conceived through rape. Others even while dying slowly from HIV since they lacked treatment in the late 90s. And they were infected with HIV used as a war weapon by the genocidaire. They forgave their perpetrators who intentionally infected them. These women are peace and reconciliation builders and showed me that building a country is key for the future of our children. The heart and the mindset of these women continue to inspire me.
Thank you very much for your inspiring words today. I think everybody sitting here will walk away feeling incredibly lifted up by that final answer. And I always like it when people cite normal women rather than well-known women as their inspiration. Thank you very much for joining us today, Agnès. Thank you.
Thank you for having me, Andrea.